My name is Randy Lee Giamuso, and I'm from the Federal Bureau of Prisons Office of Public Affairs. We're here to mark the director's second anniversary by going on the record to discuss some of her most significant accomplishments and challenges. Thank you for tuning in. We are officially on the record with Director Colette S. Peters. So, Director Peters, it's been 2 years. What has that been like for you?
You know, in some ways, it feels like it's happened so quickly, and in other ways, because the welcome to the Bureau was so exceptional, I feel like I've been a part of this family for a long time. And so it's been fast and furious. I visited over 50 institutions in the last 2 years. And just meeting our people. You know, I knew when I joined this agency that the headlines described it as a struggling agency. But having been in corrections for over 20 years and in public safety for over 30, I knew what I was going to find. I was going to find hardworking, ethical corrections professionals proud of what they were doing. And in fact, that's what I've seen. Every institution, just getting to walk the halls and talk to our employees. Not only are they so proud of what they're doing and excited to show me what is happening, boots on the ground, I'm also learning how exhausted they are. And I know you want to talk about that a little bit more,
Yes.
But it's certainly something that I've seen time and time again.
As you are aware, many of our employees feel exhausted and overworked. Staffing levels are a major source of employee dissatisfaction and burnout. So can you tell me where you are with staffing?
Yes, so staffing has been an issue for years. The pandemic compounded it, and the inability to hire in law enforcement has changed in this country over the last few years. And so this is something that we have been talking about since day one on the job, that we have a staffing crisis. And so we have been focused primarily on correctional officers and health services employees to ensure that we can change those staffing ratios. And we have. We have moved from 87% in the last 2 years to 91%. Now, to that individual correctional officer who has to pull 3 mandated overtimes, those numbers mean nothing. And they share that with me when I walk the halls of our institutions. We've been saying exhausted. There's almost a better word. There has to be a better word for it. When I talk to our people, what they say is not only is it exhausting to have to engage in these mandatory overtime shifts and deal with augmentation, it impacts their family. So not only is it impacting their physical and mental health, what they're saying to me is we mess up their routine. So they have it planned out. Who's picking up the kids? Who's cooking? What's the family schedule like? And because of mandatory overtime, we mess that up for the family as well.
Are you able to elaborate on the special pay scale that you referenced at your July 23rd congressional hearing?
Yes. So let me tell you what's led up to that. We have pulled the lever on every resource that we can, and that we have the authority to pull inside the Federal Bureau of Prisons. So we have increased the base salary for correctional officers by $2,000. We have increased the age availability from 37 to 39. We have paid over $128 million this last year alone in recruitment and retention incentives. We have changed how we're marketing. We've changed how we're advertising. We've decreased the amount of time it takes for someone to onboard at the Federal Bureau of Prisons, and yet it's simply not enough. And so what I have said time and time again is all of those incentives, all of those tools that we've brought to the table are temporary fixes. The long-term solution has to be an increased base salary for our corrections professionals. We simply do not pay our people enough. The average onboarding salary for a correctional officer, as an example, is $55,000, where in New York City Corrections, they're advertising $130,000 a year after just a few years on the job. I hear anecdotally stories like an officer out of our Massachusetts facility who left because he got a better offer with better pay at a local grocery store. So that's what has led up to this request. And we have been working closely with the department and OPM to ask for a special salary rate for the majority of our employees who are working inside our institutions. And so I had the privilege of talking about that at the House Subcommittee meeting this week to really describe the needs and the challenges that we have. If, in fact, that special salary rate is approved, we're going to need help from Congress. We estimate that that request is going to cost hundreds of millions of dollars. But as you saw from the hearing, they heard it loud and clear, and there were many people around the dais that wanted to help us with that challenge.
So as you combat such significant staffing shortages, what have you been doing to try to address employee wellness?
So employee wellness is one of my top priorities. Our people are our everything. We are a human organization. We are humans who take care and control the custody of other humans. If our employees aren't healthy and strong and stable, our mission is lost. And we have a long way to go. So we have started to change a handful of our policies to allow for an extension of EAP. We've expanded the mission of our crisis support teams so that they can respond to employee wellness. We now have the ability for the warden to allow someone to take time off after a traumatic event. We have just advertised for a nationwide wellness coordinator so that we can really bring focus to this very issue. But I think at the crux, it's the staffing. It's the recruitment and retention crisis. Until we solve that problem, until our employees are no longer riveted with mandatory overtime and the wear and tear of augmentation, the rest of these initiatives are lost to some degree. That is the core of our issue right now. As I mentioned, we are working closely with the department to see if we can get a special salary rate for our employees who work inside of our institutions. And as I mentioned earlier, we're establishing a nationwide wellness coordinator who will then see a new wellness branch inside of our human resource division that will really drive initiatives across the country and create innovative ways to support our employees.
So along with enhancing the culture, we've seen that you focused on our mission, vision, and core values. Can you elaborate on that a little bit?
Yes. So out of the gate, the executive team and I really went back to basics. We looked at our mission, our vision, our values. We looked at where we wanted the agency to go and how we wanted to enhance it. And words matter. And so we looked at our mission, and while the core of our mission is never going to change because it's about safe and secure institutions and reentry and ensuring that the individuals, when they get back into our communities, are good neighbors, words matter. So now we're using words like normal, humane, compassion, and of course, the core values of integrity, respect, correctional excellence. And we're doing that because while some of those words aren't normal to corrections, we know that if we create environments where those words are being used, it's that, again, that more normal, humane culture, both for our employees and those in our care and custody. So I've said from day one that transparency is incredibly important to me as we are public servants in government. We need to be good stewards of the taxpayers' dollars. We need to be accountable to the citizens in this country as well as to Congress. And so we've worked really hard over the last 2 years to kind of open our doors and say, come on in, come see what we are all about. And we've done that with members of Congress who have visited our institutions. We've had multiple interviews with members of the media across this country. We have had ongoing listening sessions and engagement with stakeholders, advocates, individuals who were previously incarcerated, their friends, their family, their loved ones. I've had countless sit-downs and one-on-ones with members of Congress, including 7 official visits and sites to the Hill in public forums to tell the real story of who we are and what we're about and what our corrections professionals do day in and day out. We really wanted to enhance what our Office of Legislative Affairs and our Office of Public Affairs has been able to communicate and get out. We didn't want the one bad headline to rule the day, but to really talk about the important work that our people are doing day in and day out to get the true narrative out there. And I'm so grateful for the department's support in those proactive conversations with members of Congress and members of the media. That's not something the Bureau was allowed to do previously. And I think that that really is helping change people's trust in us, people's assurances in us. And it's one of the best things I get to do as the director is tell the real story of our corrections professionals.
Director Peters, you have completed several mission changes. Are there any you would like to address specifically?
So we have engaged in multiple mission changes. The executive team has worked diligently to look at specific institutions' missions so that we can manage our population more appropriately, provide FSA programming where we need to provide programming, and ensure that people are closer to their release locations when they are with us. In addition, I'd like to talk about 2 major mission realignments that I think is on everyone's mind. The first being our facility in Thompson, Illinois. We had to take significant action after some of the allegations that were coming forward around employee misconduct and simply how that institution was being run. So we temporarily vacated units in that facility, rebooted our employees' training, and changed the mission. We did the same thing at Dublin. So when I came on, we all heard the headlines, saw the egregious stories of some of the employees engaging in horrible sex abuse and employee misconduct. And we poured resources into that institution. We added employees. We had a special investigative agent assigned to the facility. It was the first facility to have a family support coordinator. We engaged in recruitment and retention incentives to keep the good employees that were working so hard at that institution. And yet, we couldn't get it running where we needed it to be. And so we made the tough decision to temporarily vacate that institution. Right now, those employees are engaged in some pretty intense training as we do an assessment, both a safety and security assessment, an architecture and engineering assessment, and then once we have that data, we'll make a determination around the future use of that facility.
While we know the vast majority of our employees are hardworking, ethical corrections professionals, misconduct has certainly been a major black eye for our agency. So what progress have you made in rooting out misconduct?
They are as disheartened as you and I are that an individual would make that choice. And so we've done so much to hold those individuals accountable. When I first started, we had less than 30 individuals who worked in the Office of Internal Affairs. We now have almost 150. We changed the reporting structure so that those individuals reported up to headquarters, to our chief of the Office of Internal Affairs, not through the warden, to ensure that there wasn't even perceived obstruction to those investigations. And we have worked diligently to shore up the backlog of investigations. As the former Inspector General of Oregon and as the Director of the Federal Bureau of Prisons, when employees are under investigation, that really puts a toll on them. And so to have to be under investigation for a lengthy period of time when the investigation may conclude that they've done nothing wrong is hard. That's wear and tear as well. And so we want to ensure that if employees have engaged in misconduct, we know that in short order and we can hold them accountable. If they haven't, we need that investigation wrapped up so they can come back to work. I also want to talk about the addition of a chief inspector position. This is something we've been thinking about for a while. While we're very reliant on our internal audits, while we are very reliant on recommendations from GAO and the Office of the Inspector General, we'd actually like to be more proactive and have this new chief inspector position look at data and determine where our hot spots are across the country so that we can get out in front of any cultural issues, where we can get out in front of any trends that we're seeing so that we don't have another situation at Dublin or Thompson or Atlanta, but we're able to solve those problems before they get too dire.
So advocacy groups are calling for compassionate release for individuals who have been sexually abused while in our custody. Can you provide any updates on that?
Yes. So happy to let our stakeholders and our employees know that even ahead of the U.S. Sentencing Commission's guidelines change that allows for confirmed victims of sexual assault inside our institutions to be eligible for compassionate release, we had already begun reviewing those and approving those. So we have referred 6 of those to the courts that were ultimately approved for individuals that were confirmed victims of sexual assault while they were in our care and custody.
So switching gears, the First Step Act is always a major source of controversy. There's a perception that earned time credits are not being applied properly. Can you clarify anything on this subject or fill us in on any new information that you have?
I'm happy to. And for those of you that watched the hearing this week, I think you'll see the tide is starting to change because of the incredible work that's happened inside our institutions. The First Step Act is just part of who we are now. And it's just, I can see it again and again as I walk the halls of our institutions, talk to our employees, see the programs, see the expansion of programs. The creativity in our institutions right now around First Step Act programs is just through the roof. And our earned time credit calculator is not broken. When we hear about individuals who have something that has a calculation that isn't matching up, what we found is that it's human error on the inputting of the data. The earned time calculator is up and running. Not only that, but we are now projecting for those in our care and custody what the earliest potential release date they could have if they engage properly inside our institutions and if they continue with programming and treatment. And I think that's really going to help. I'm a behaviorist by training, and so getting that carrot out there for those in our care and custody to know that if they behave properly, that they know their earliest release date.
Incarcerated individuals and advocacy groups are calling the agency out for the lack of residential reentry centers and lack of motivation this creates amongst the incarcerated population in terms of First Step Act incentives. What can you tell us in response to these concerns?
It's an accurate concern, and I hear it when I'm inside our institutions talking to our employees who are frustrated. They see that individuals are ready to get back into the community. They have the earned time credits to do it, and yet we don't have placement available. I hear it from the adults in custody when I walk the institutions, and they are confused and frustrated, frankly, because they've done the programming, they've done the treatment, they've got the face sheet that says they're ready to go out into the community. So this is almost as significant of a problem as our recruitment and retention crisis and our infrastructure crisis. Because as you're aware, our residential reentry centers were created before the First Step Act. And so prior to the First Step Act, someone might spend weeks or months in a residential reentry center. Now, under the First Step Act, they could spend months or years. And so that has created a substantial backlog in our residential reentry centers. So it isn't for a lack of trying. Our team is working diligently across the country to be creative and ensure that the flow is happening properly. But the reality is we need more residential reentry centers in order to engage in this appropriate step down to the community.
So, Director Peters, why not just release them all to home confinement then?
Great question. So when someone is released to home confinement, they still have to be monitored by the Residential Reentry Management Office. And so that's a resource issue as well. And so it's not as simple as that. And so the additional resources are not just related to the residential reentry centers, but to the employees we have to do that supervision. So I'd like to circle back to the First Step Act again, because one of the changes that we're making is creating a nationwide FSA office to help really ensure that we're able to consistently respond to questions from Congress, ensure that the spending of those FSA dollars are being utilized as effectively and efficiently as possible. So while I walk the halls of our institutions and just am incredibly impressed with the creativity that's happening boots on the ground, I think that this office will help us better tell our national story and improve and enhance those reporting requirements.
The Government Accountability Office released a report on the Federal Bureau of Prisons' use of restricted housing unit and concluded that we continue to house a high number of individuals in special housing units. Some of your staunchest critics say that restrictive housing is inhumane and has long-term consequences. Can you discuss any significant changes that you have made to address this criticism?
Yes, so I think we know, research is very clear, that long-term housing and restrictive housing can cause damage, both mentally and physically. I've talked about this publicly. And so I think while restrictive housing is a necessary tool to keep our employees safe, to keep those in our custody safe, we have some work to do here in terms of reform around restrictive housing. In addition to GAO's report, there's also an executive order from the president saying that we need to reduce our numbers. And while they've dropped ever so slightly in the last 2 years, it's just ever so slightly. And so I will tell you that the wardens across this country, the folks inside our institutions have been incredibly creative, establishing GROW units, expanding our reintegration units, the creativity out there to really ensure that not only are there step-down plans for individuals, but they're now creating units that would prevent someone to go into restrictive housing. Let's say, as an example, if someone wanted to PC up, when you look at the numbers, we see that time and time again, that people are getting off the bus, walking into the institution and saying, put me in restrictive housing. So how do we get those individuals to think differently? How do we get them to a place where they feel comfortable walking in general population? And I think that's really what our folks boots on the ground are really focused on. In addition to that, we've worked very closely with our national union to revise our disciplinary hearing policy. I think this is going to have substantial impacts. As you look at the policy change, it actually will reduce the amount of time that a hearing officer can place someone in restrictive housing by almost 84%.
As corrections professionals, we have known for decades that we're a healthcare organization. Advocacy groups say we need to do better with medical and mental health care. What do you say to that?
So first, you're absolutely right. We have 155,000 patients at the Federal Bureau of Prisons, and we really need to be thinking about it from that perspective. They are 10 years older biologically than their chronological age. They have had a lifetime of not having preventative care. They come to us with significant chronic disease. And so the research is very clear. If we can help them with their physical and mental health, well-being, the better off they'll be when they step inside our communities. And so there's so much we're doing. First, we have an external organization reviewing our healthcare program, everything from quality assurance, timely use of healthcare, and really looking at our ability to enhance that service, because as we talked about the recruitment and retention crisis, it's not just our correctional officers, it's also our doctors, our nurses, our psychologists. And so we've been working diligently on efforts on recruiting individuals so that those positions are full. When I started, it was very common to walk into an institution and have only half of our health service positions filled. So we've been working diligently to get those positions filled. Furthermore, we know that mental health is often a driver to the criminal justice system. And so I'm very proud of our PhD level psychologists that we have across the country, assisting those in our care and custody with their mental health, with the programs that we have, the evidence-based programs. All of that really helps ensure that when these individuals leave our care and custody, they are those better neighbors.
So I want to swing back, Director Peters. We touched on infrastructure earlier, and I want to go back to that. The work environment and infrastructure in so many of our institutions are at a critical point, which is equal to our recruitment and retention crisis. Yet across the country, as you mentioned, we have a maintenance and repair backlog of over $3 billion, and that number only represents the most serious repairs. Our facilities are aging, they're falling apart, and our internal and external stakeholders want safe, humane, and clean facilities. So what are you doing specifically to address this?
Yeah, so that's right. Nobody wants to come to work with a crumbling infrastructure. And so over the last 2 years, I have taken every opportunity to talk to members of Congress, to talk to the department about this substantial concern. When you refer to that $3 billion number, I think it's really important for people to understand that's only the highest need category. That's our life and safety categories. That doesn't include the equipment that needs to be repaired and might last longer if we repaired it now. That is literally the most critical repairs that need to happen. That means the roofs that need to be repaired, the HVACs that need to be replaced. And so we're doing a handful of things. First of all, I think it's important to know that over the last 10 years, the average amount that Congress has given us for that $3 billion problem is $100 million each year. And so our facilities crews out there across the country are unsung heroes, holding it together with duct tape and baling wire and not enough resources to get it done. And we have engaged with an external contractor who's come in, who's going to do, is currently right now working on an assessment so that we can, in addition to the 5-year plan where we're addressing the most significant concerns immediately, that we have a 10 and 15-year plan to figure out how we're going to get these aging infrastructures back to where they need to be. And then I'd also like to talk about a couple of initiatives that we believe will streamline the organization, make us more efficient, make us more effective. The first one being a reorganization in our information technology and data division. We want to be more data-driven. We have at the Bureau endless amounts of data, but our ability to analyze and use it to drive policy decisions hasn't been there. And we think this reorganization will really help us. In addition, we're bringing in presidential fellows to help us analyze the data and create a base for us to be able to explore policy decisions going forward in a data-driven way. The next is a contracting officer reorganization inside of our administrative division. We've received several critiques from the Office of the Inspector General and the Government Accountability Office around some of our procurement practices and policies. And so we're hoping that centralizing these officers across the country into a reporting structure directly to headquarters will help ensure consistency in those practices. Another important reorganization that I would like to highlight is that we are moving the Psychology Services branch into a newly formed branch called the Behavioral Health Branch inside our Health Services Division. We're doing this because it is really in line with best practices in the community as we move toward that continuity of care for those in our care and custody. I mentioned previously we are a healthcare organization. This lines up perfectly with that notion, as behavioral health and physical health are so intertwined at every level. And so we're really hoping that this reorganization will better serve those in our care and custody so that when they leave us, they have improvements mentally and physically as it relates to their overall health.
Director Peters, communication with incarcerated individuals and their families has been noted as a major issue and recurring theme at listening sessions. What are you doing, or what have you done to address this?
Well, thank you for mentioning the listening sessions. So it's been something that we've engaged in over the last 2 years. We've been able to have sit-downs with our national union to really hear from them about their concerns, what's working, what's not working. And we reached out to our external stakeholders to sit down and really hear from them around what's been working, what's not been working. That includes formerly incarcerated individuals and their families, friends, and loved ones. And we've taken that feedback very seriously. So one of the things that we've been able to do is create family support coordinators in each of the regions across the country to act as a liaison between those in the community and those who are incarcerated to ensure that the flow of information is happening and that we can get information out to them in order to ensure that they're feeling heard and knowing that someone is really focused on their loved one's care.
Why is the Federal Bureau of Prisons seeking feedback on access to counsel at pretrial detention facilities?
So this has been a really strong initiative for the Department of Justice, specifically the Office of the Deputy Attorney General and the Deputy Attorney General herself. So access to counsel is so important, especially in that pretrial status. And so we've been working diligently to ensure that we have the resources available in those facilities so that individuals have that access to counsel.
Can you tell us what is happening at MDC Brooklyn?
So MDC Brooklyn, many things are happening at that facility. They are certainly riveted with a staffing crisis, which I think is a major driver of some of the issues that are bubbling up out of that institution, and also a maintenance repair backlog that is just incredibly substantial. And so we created an urgent action team headed by our associate deputy director, who has a whole group of individuals who are able to bring resources, make decisions, and ensure that that warden and his team are feeling supported as we manage through some of the critical issues that that facility has been faced with for years now.
Director Peters, is there anything that you would like to add that I didn't address?
Gratitude comes to mind. I am so grateful for the 35,000 employees we have across this country who do heroes work. The brave men and women that we have engaged and focused on our mission is an inspiration to me. It's why I love what I do. So I just want to say a huge thank you to them for the work that they do day in and day out, and know that you have an executive team that's working every day to get the resources that you need to do your job. And I'd also like to say thank you to our stakeholders who have been open in dialogue with us over the last 2 years and are committed to the Bureau's success. To them, I would like to say thank you as well.
It looks like you have some big things planned and some very lofty goals laid out. Is there anything else you'd like to talk about that we haven't covered?
We've covered so much today. It's just been a pleasure sitting down and talking to you. We do have big plans, and I'm excited to see them implemented. I want people to know you've got a great executive team that's working hard on the strategic plan and the strategic vision. And I want people to know that it's just been an incredible 2 years, and I have every intention of continuing in this role for as long as I can to push those initiatives forward. And I think work, I would like to say thank you to those out in the field for your patience. We're working diligently to get into all 121 of our institutions. Like I said earlier, I've been to 53, and those are my best days. I love walking the halls of our institutions and meeting the brave men and women who do this work day in and day out. So I look forward to getting back out on the road and meeting more of our heroes.
Thank you so much for your time, Director Peters.
Thank you.